Hello and welcome to our webinar from HealthLight, where we talk about implementing light therapy into your podiatric practice. My name is Rob Berman. I'll be your presenter today. A little bit about me. I work at Energia Medical. It's an energy device company. We are the national distributor for HealthLight. I've written over 10 ebooks on light therapy and lasers. I've also had over 24 articles published about light therapy, lasers, and practice management. So let's get into our webinar. We're going to talk about lots of things today, including science behind light therapy, what are the benefits of light therapy, what NIR light therapy is used for, how you might implement light therapy into your practice, of course, how HealthLight can help you support implementing the HealthLight product features, and our most frequently asked questions. Let's start off with a quick video introducing you to HealthLight. If you'd like to get that video into your practice or show it on your website or social media, let us know. Marketing@healthlightllc.com. That's marketing@healthlightllc.com. So how does light therapy work? We're going to aim to increase the ATP synthesis in the mitochondria. We're going to activate the electron transport system and many other biochemical and biophysical reactions in the tissue. You can see the lights on the left. We're showing them red here because the infrared can't be seen. You can see it entering the body. And we know decades of research have found that certain wavelengths of light within the blue, red, and infrared bands can be beneficial to living tissue. That light is going to trigger the nitric oxide from blood vessels and red blood cells. And that NO is going to cause local vasodilations that will last several hours after treatment. The vasodilation is going to significantly improve blood flow, and of course, by improving blood flow, we're going to promote positive changes in patients. We're going to lessen pain. We're going to help the nerves begin to carry sensations again. The infographic on the left, the wheel, is a nice representation to talk to patients about. You start up at the top at 12 o'clock. The photon energy comes into the body. It releases nitric oxide. That nitric oxide is going to lead to the increased vasodilation. Vasodilation increases the blood flow, oxygen, nutrients, pulling out the waste products more quickly. As we get down towards 6 o'clock, the cells and nerves are going to operate much closer to homeostasis. We're going to reduce pain. And as you slide up the other side, the red side here, because people are going to be in less pain, They're going to sleep better. They're going to have healthier nerves firing. They're going to feel better. We're going to get that increased circulation. It's going to help healing. Of course, reduction in risk of falling from a lot of conditions. And then we treat again and get this virtuous circle. When we pair this together with a variety of physical therapy exercises, modalities, whether it's done in your office, at home, or by qualified physical therapists, we know that combining these multiple modalities are going to provide us with a quicker and better resolution for patient complaints. Our palette of colors. Why do we use different colors? Depth of penetration. So you see on the left, we've got the blue, the red, and the infrared, which is just a teeny little bit of the overall spectrum of light that we've got. And those different lights are going to give us different levels of penetration. And by getting the light into the body, we're going to kick off a variety of different biological effects, whether it be anti-inflammation or anti-pain. We're going to accelerate tissue repair, cell growth, and uptake in immunoregulation, improve nerve function, vascular activity, metabolic activity. We're going to reduce the fibrous tissue formation, get rid of those scars, whether those scars are from surgery, from cuts, burns, whatever the case may be, and of course, trigger point acupuncture point stimulation. Let's go into a little more detail about some of those biological effects. So in terms of the anti-inflammation, we're going to get an anti-edema effect. We're going to cause the vasodilation. We're going to activate the lymphatic drainage system. We're going to reduce that swelling. In terms of pain and reducing pain, the analgesic effect, we know that light therapy has a highly beneficial effect on nerve cells. We're going to block pain signals transmitted to the brain. We're going to decrease the nerve sensitivity and inflammation. Obviously, less edema leads to less pain. We're going to produce pain-killing chemicals that are going to help the body naturally. Accelerating the tissue repair and growth. The photons of light are going to penetrate deeply into tissue, accelerating the cellular reproduction and growth. The light's going to increase our ability to intake cells, enabling quicker absorption of nutrients while eliminating waste products. Immunoregulation, we're going to have a direct effect on the immunity status by stimulation of immunoglobulins, lymphocytes. All this light is going to be absorbed by the chromophores that will react to the light. We're going to create a variety of enzymes that are going to produce ATP. And the ATP is a major carrier of cell energy and energy source for all chemical reactions in the cell. Improving nerve function, the light's going to increase the process of nerve cell reconnection. We're going to increase the amplitude of action potentials. We're going to optimize nerve regeneration. The last couple biological effects. So we're going to improve vascular activity. By having the light continuously coming in, we're going to actually form new capillaries in damaged tissue. We're going to be able to accelerate the healing process, reducing scars as well. When we increase the metabolic activity, we're going to increase that output of specific enzymes. We're going to increase oxygen for the blood cells. Looking at scars, the fibrous tissue, we're going to work on those cuts, scratches, burns, surgical scars as well. And of course, when we treat trigger points, acupuncture points, we're going to be able to non-invasively provide musculoskeletal pain relief. Let's summarize a little bit. What can we use NIR or near-infrared light? Pain, circulation, relaxation of muscles, relief from muscle spasms, aches and stiffness caused by arthritis. A lot of research has been conducted, actually thousands and thousands of studies about light therapy and lasers. We've got some of those on our page shown here. Feel free to go over to the research page on the HealthLight website and take a look at them. If you like a link to that, please let us know. Marketing@healthlightllc.com. That's marketing@healthlightllc.com. One of the things that come into your office pretty regularly is going to be neuropathy. This is a handy chart to talk to patients about. We've got normal on one side and critical on the other. Most people, of course, are someplace in the middle. This is a way to visually talk about, to use a scale with your patients. So when we look at some of the research that was conducted on peripheral neuropathy and combine that with that chart, you can explain to patients what's going to happen. So in some of the research that we've seen, when you combine the physical therapy type things together with the light therapy, we're going to improve balance, we're going to improve the gait, we're going to reduce the fall risk. And there's also been some studies as shown here with an actual protocol when you go through and we treat multiple times per week for a period of time, specific wavelengths, specific places, we're going to end up with improvements in sensation as well as function. Let's look at wound healing. So as we know in wound healing, a lot of the normal things we want to have happen are actually working in the opposite. So circulation is going down, inflammation is going up, our immunity goes down, the angiogenesis goes down, et cetera, et cetera, et cetera. What we want to have happen is the opposite. We want to be able to turn around and have that increase in circulation, the increase in angiogenesis. We want that healing of some of the wounds, and lights can help do that. So if we look at some of the studies, in Hargate's double-blind study, a major finding was significantly reduced time to complete healing and accelerate crust formation. In Nather's study, the major finding was complete wound closure in a number of cases, as well as reducing the size of the wound in another case. When we look at, in summary here, the fast-growing field of light-induced photobiomodulation, or PBM, is going to continue to offer painless, potentially non-invasive, drugless biophysical therapeutic intervention for those chronic, non-healing wounds, especially when you compare them to some of the conventional therapies that have failed or have unacceptable side effects. Some of our pads have blue light, and research has shown in blue light, in particularly, that they're intrinsically antimicrobial. That can be very helpful also with some of those wounds that you have. So when we look at some of these wavelengths, we know that they can photodynamically inactivate the cells in a wide spectrum of bacteria, gram-positive as well as gram-negative, as well as fungi. This blue light is going to lead to energy transfer and the production of reactive oxygen species, and that's going to go in and work on some of those wounds and infections. So how do you talk to your patients about pain? The APMA has said that, in a fairly typical office, at least a third of the patients coming in to see you are going to come in with heel pain, whether that's heel spurs or plantar fasciitis, whatever it may be from the APMA data, but we know it's going to be some kind of pain. So this is a handy poster we've created to show some of the things that light therapy can be used for. It's a nice way to talk to patients, and obviously you want to put it up on the wall, put it in your social media, put it up on your website. And if you'd like to get some of these posters, we're very happy to send them to you. So let's look at a little more in-depth, how does light therapy relieve the pain? Sometimes when we talk to patients, we just say it's magic, it works. But some patients want to know a little bit more of how it actually works, some of the technology behind it. So we're going to increase the nitric oxide, as we've talked about. We're going to increase the beta endorphins. We're going to decrease the bradykinin levels. And we're going to level out the ion channel normalization. In addition, we're going to increase the nerve cell action potentials. We're going to block the depolarization of C fiber afferent nerves. We're going to increase the release of acetylcholine. By doing these things in conjunction with each other, we're going to get that pain relief or analgesic effect that we're seeking. So let's quickly summarize. How do we increase circulation and cause that pain relief? So one of the most dramatic effects of this light therapy we know is going to be the triggering of the nitric oxide. And since nitric oxide is a body's natural vasodilator, it's going to widen the blood vessels and capillaries. If you look at the picture on the bottom left, you can see a flow through. On the right, you see a much increased flow. This is an illustration of what happens after just 20 minutes of light therapy. We're going to dramatically increase circulation, and we know it's going to last for several hours after that treatment. And because the nitric oxide is also a messenger molecule, it's going to trigger healing processes in the body. And of course, the infrared and red light is going to increase the circulation, speed healing, and relieve pain. So let's take a different look at this by viewing a more scanning laser Doppler photos. So photos on the left are pre-treatment, photos on the right are post-treatment. And by us showing one with some and one with more on the right, it typifies what's going to happen because different ages, different disease statuses, exercise status, weight are going to be variables that are going to drive how quickly the light is going to impact the body. Each person is going to have their own healing level, but we know as you keep treating over time, we're going to get more and more increased flow. What about muscle spasms, aches, and stiffness? Well, light therapy dramatically stimulates muscle trigger points and acupuncture points non-invasively, providing the musculoskeletal pain relief. After just 20 minutes of this light therapy, patients are going to experience relief from those spasms, aches, and stiffness. And we know acute conditions are going to generally respond quicker than chronic ones because it took a while for them to get to be chronic. In terms of acute, we often have patients feeling better in the first couple of treatments, many times in that first treatment. In terms of chronic conditions, maximum improvement, depending on your conditions, could take up to 24 to 36 treatments, and then we have a maintenance treatment thereafter. Now remember, at home treatments, we can treat up to twice a day, so we can get to this level of 24 to 36 treatments within a few weeks. Let's take a listen here to Dr. Tom Burke. He's a PhD in physiology. He's going to summarize some of the science for us.
I'm a retired physiologist from the University of Colorado Medical School. Worked there for approximately 30 years. Retired about 10 years ago. I have a PhD in physiology, and I've been working in blood flow changes throughout my whole career. My interest in blood flow led me about 15 or 20 years ago to examine the effects of infrared light therapy. Infrared light therapy increases blood flow at any site in the body that it's applied to. The beauty of it is it's a non-invasive, drug-free way. Working in concert with physicians and pharmacology and pharmacists, we've been able to see an improving outcome for patients by increasing the blood flow. About 1993, a paper from Duke University suggested that red blood cells actually carry a compound, a gas called nitric oxide. And it turned out that the link was that the infrared light would release the nitric oxide from the red blood cells at the site of treatment. In 1998, 3 Americans were given the Nobel Prize for their discovery that nitric oxide actually dilates blood vessels and improves blood flow. This is called near-infrared light. It's very close to the red wavelength that you and I can see of red sweater or red tie, but it's just outside the human body's ability to envision the light. So it's essentially invisible. This near-infrared light is a very unique wavelength that's used for healing, if you will. There's some exciting things coming out of Harvard, Boston University, even the University of Wisconsin. Those 3 places have photonic, if you will, institutes in their medical schools and their institutions. They are looking at treatments of using near-infrared light therapy. Infrared light is a non-invasive, drug-free way cleared by the FDA for doing 2 things: increasing circulation and reducing pain. I don't know of any serious side effects to infrared light therapy. If you can increase blood flow to the lower extremities, for example. So there are conditions in which the broader medical community looks down at infrared light therapy and says, this could help my patients in my particular practice.
So that's a nice summary of some of what we've been talking about. So what about using multiple modalities all at the same time? We've touched on that a little bit, and yes, we believe that multiple modalities should provide a better and quicker resolution. So if we use physical therapy techniques, if you put together things like nutrition and vibration, massage, electrical stimulation, PMF, laser sometimes, which is a different form of light, attacking some of these conditions in multiple ways is going to get us a better and quicker resolution. So let's take a look at what you might offer in a package to your patients. Let's talk a little bit about how this might work. And the next slide will show us how you show it to patients. So here in this example, we've got a range of 5 options from office only to home only and combinations in between. And we've got the ability to do light therapy, laser, vibration, vitamins. You can plug in anything you want in this chart, add, delete, whatever. It's just illustrative. But what's key here is we want you to go ahead and establish a baseline measurement of what's going on as appropriate, have some of those objective measures. So for example, if blood work or an NCV or a punch biopsy is required to show what you want to show, go ahead and do some of that stuff. And then start down the treatments. And at the end of the treatment cycle, we're going to go ahead and repeat those objective measures so we can show to the patient, and you can, of course, put this into your electronic health records, what has transpired. So in this example, what we're looking at is the idea of potentially office only, home only, combination thereof. Many people will do some portion of this in the office, and then have, for example, light therapy at home as an ongoing treatment to not clog your office and your flow with all these repeat patients, as you can accommodate your normal and then your new patients as well. So this is kind of the idea. You wrap it together in a case feed. Now let's see what it looks like presenting it to a patient. So here we've turned the chart a little bit on its side. You would fill in your information up at the top. And again, we have the same conditions. You adjust what it is you want to do. You can add, you can delete, etc. What's important here is we show it's an investment for a patient. So it's not an expense, it's an investment in them getting better, feeling better. And we show 1 leg, 2 legs, not because all conditions are bilateral versus single, but because some of the products that you may use, for example, the light therapy, can be purchased single leg or dual leg, so that would drive the cost to be a little bit different along the way here. So as you see in the notes here, and you talk to your patients about it, based upon the examination, the findings, we know where we're starting. We always want them to understand how it goes through the program. We want them to go through, in this example, 12-week program. And we also want them to share with you or your staff how they're feeling. So you can go back at the end of, in this example, the 12-week program and say, you started here, you've ended here. We want you to continue doing nutrition, for example, because that is helping with your blood work. We want you to keep doing the at-home light therapy or convert over to doing at-home light therapy to maintain your improvement. We have lots of materials like this to help you on our support pages. This page is going to show you we've got some training, we've got usage guides, we've got video training. This is, a lot of this is on a password protected site. When you start selling with us, or if you're already selling with us, just request it. We will give you the site and the passwords. You get things like press releases, customizable posters. We showed you some in here. Blog posts you can use. We've got letters to announce what you're doing out to some of your colleagues, particularly those folks who give you referrals. And of course, we continue to share ideas that we get from other providers like you. So we've showed this pain poster a little bit earlier. This is available on the site. It's a great item to use in the office or in your social media. We've got this nice brochure. We can mail these to you. If you like some of them, let us know. marketing@healthlightllc.com, marketing@healthlightllc. We've got these ebooks. Again, let us know if you want to get the ebooks. We have a whole series of them. This is our Light Therapy Relieves Pain ebook focused on pain. Let's look at a testimonial that you can also play in the office or play on social media, and we can, of course, send this to you as well.
I did not have a lot of trouble with my hands. My problem was with my feet. It was a problem with standing, although when I get involved with the quilting, I don't notice the pain in my feet. I forget about that. My mind's so busy thinking about what's going on with the quilt. So I was afraid that I wasn't going to be able to stand much longer. I wasn't going to be able to get up and down my steps much longer. I noticed my customers were saying, they would call and say, "Are you still quilting?" So I think they were seeing that I was getting maybe frail. For the first diagnosis, we had been on a trip, and while we were on the trip, my walking changed. I didn't figure out why, but that's been more than 4 years ago, I think, and it just progressively got worse and worse until it was getting to the point where it was pretty debilitating. I think about 6 months ago, I realized that I wasn't going to be able to do this as long as I had hoped. It was very, very discouraging and until I saw that ad, and it was like, oh, please, let this be something. I've got to try something. Doing nothing isn't doing it for me. Now, it's been about 4 months, and as long as I'm still going forward with getting better, that's just going to be wonderful. It just meant we could live our life like we've been living it. That we weren't going to have to downsize it, that we weren't going to have to do less. We could keep doing all the things we'd been doing. We could keep following our grandchildren. I could keep quilting. I could keep going to see my friends. I could do everything I had been doing. I'm going to go and do all the things that we've done before. If we want to travel, I'm going to be fine with that. I think I can do anything I've done in the last 20 years, or 20 years ago.
So we've also got materials in Spanish for you. This is the same poster, but shown in Spanish. We've got other ebooks as well. This is our Introduction to Light Therapy ebook. This is a nice one to have in the office or to show patients, or to potentially pull some pieces of it and put it on your website, or to put it on social media. That same wheel we talked about is also available in Spanish. The press release I mentioned. We've got a variety of blog posts. You can see Beth up there in the top. The letters to other providers in the area to increase your referrals. We've got a product portfolio, and in this product portfolio, we show each of the pads in a variety of different placements, conditions, so you can visualize how to use it. You can also take it and show it to patients how it works. So let's summarize some of the product features here. So HealthLight is manufactured in the US in a facility that is ISO certified. We've got over 15 years of experience in this light therapy space. Our product lines are going to include blue, red, as well as infrared lights. And these pads can be applied directly to the body, unlike some others on the market where you have to stand a foot or more away and lose a lot of the intensity of the light. They're highly flexible. They're not rigid. You can see in the top photo how it can bend over the foot, or in the bottom how it can be opened up and treat somebody. Pads can be used up to twice per day or multiple times a week in the office. Quick 20-minute treatment cycles, simple one-button controls, highly portable. We've got a 9-foot cord on these to plug it in to the wall. Of course, it's FDA listed. 2 lines of products, clinical as well as express. So what's the difference, and why would I want one of those? So the clinical products allow, of course, for unattended treatment, and you can plug in up to 6 pads into one controller, so you can treat an entire body or multiple parts of a body, or more importantly, you can actually treat 2 patients with the same controller at the same time. You're going to charge cash for these treatments. In terms of the express or the at-home product line, it's designed for home use. So you would buy it wholesale, sell it retail for cash. We can drop ship to the office or to your patients. So these controllers I mentioned are on the left. We've got a 3-port version and a 6-port version. allows you to plug in any of the pads. And these all operate on different Nogier frequencies. These Nogier frequencies have been shown to adapt to different body parts and treat them. So you can select manually from 1 to 7 programs, or you can go with the A, B, C, and the A is one set of frequencies, the B is another set, and the C runs through all 7 of them in a proprietary format. For our Express or at-home line, you see on the bottom the simple one-button control. Up at the top, we've adapted it so you can actually use it in the clinical line if you choose to as well, but it'll run only the one set of programs, the A or the B. What's nice about these is it's still 20 minutes, one-button control. They turn off automatically for your patient. No one has to worry about setting a timer. No one has to remember if they've fallen asleep or don't want to move while they're reclining, watching TV, reading. And regardless of we've got blue or red or infrared here in the pads, these controllers operate the same way. The Express product line is quite broad, and you can see on the top left, we've got our foot and ankle pad, which covers the top of the foot, bottom of the foot, and up behind the Achilles. In the middle there, we've got the foot and calf, which covers the calf and the bottom of the foot. We can also open up that foot and ankle and operate it exactly the same way. In between those two is the 90 pad, which oftentimes is used on the top or bottom of the foot as well. It's about foot size, and it's kind of a nice thing to use. We've also got a variety of other sizes, whether they're medium, small, large, long, and we've got the blue and the red, as well as the blue, red, and infrared in that long 180 pad. In the clinical product line, you build together exactly what you want. So where in Express, we gang together a couple of pads, sometimes on a controller like the foot and hand one. Here, everything's individual. You select what you want. So we've got that same foot and ankle, the 90, the foot and calf, as well as all the other ones here available. You build what you like to have. To start you off with some suggestions, we've built some basic 3-port controller packages on the left. The lower extremity core package would be the one that would work very nicely in the office. So this is the foot and ankle. You can, of course, do the foot and calf instead if you choose to do that. We've got a whole body one. These are large ones. They also work nicely down the leg. And over on the right side is kind of a starter kit. It gives you a large pad and a long pad. Remember, flexibility is what this is all about. So if you want some of those large pads or the long pads, we can do those in different colors. The large pads are in blue and infrared if you choose, and the long ones are blue, red, as well as infrared. If you want a little bit bigger package, or you want to treat multiple patients at the same time, we've got these clinical packages on our 6 ports. So on the upper left, that same lower extremity enhanced package comes built in with a 90 pad, and it comes with a free 90 pad as well. And the other ones are all variations of the same thing. So if you looked at the whole body deluxe, you've got the foot and ankle shown here. We can do foot and calf, plus a variety of the other pads if you want to wrap other areas along the way. And again, you can do the blue if you want it instead of the red. That would be in the medium pads or in the large 264 pads. The 180 pads, we can put in the blue, red, infrared tricolors. So let's look at this in a quick chart to compare. So both run for 20 minutes. You can do it minimum 3 times per week, maximum twice per day. We like to have a couple hours in between those treatments and have the patient drink some water because the body will break that down. All the pads come with Velcro straps to allow for optimal placement. The clinical line is going to give you those 10 programs, where the Express will have multiple programs already built in for you. You purchase everything at wholesale. The clinical line's got a 2-year warranty, where the Express line is 1 year. And yep, they're made in the US, and we've got tricolor pads and blue pads and red pads for you. Let's go over some of the frequently asked questions. Are there any side effects to near-infrared light? There are no known side effects. Light therapy is painless and easy. However, of course, you want to take some precautions. Keep it away from the thyroid. Keep it away from the uterus if someone is pregnant. Don't use it over active cancer. How long until a patient's going to see results? Well, it's going to depend on that patient's disease state and their condition. Are we looking at an acute condition? Someone might feel better very quickly. A chronic condition, it's taken a while for them to get into that state. It's going to take a bit more time. We find there's a nice steady progression in those chronic conditions. And of course, ongoing maintenance treatments is going to let you maintain that improvement. How frequently can the pads be used? So we just talked about in the chart. Minimum 3 times per week, once to twice per day is recommended, spreading it out 2 or 3 hours. Patients often want to know, what do the pads feel like? So some offices will keep a pad there for display purposes. Others do not. But what someone's going to feel is kind of a slight warm feeling. The pads are going to operate at approximately body temperature. There shouldn't be any discomfort. Patients may also ask, or you might wonder, why only some of the lights are coming on. When we do infrared, you can't see that infrared. But the way you can tell it's working is look through a camera, look through a smartphone. You'll see kind of a purplish little glow on those infrared, and you'll know it's there. Or if you've got a clinical controller, it actually has a tester for the near infrared. What area of the body seems to have the most positive results with light therapy? It's going to depend, again, on everyone's disease state and conditions, but our best sellers are going to be the foot and ankle, the foot and calf, those lower extremity ones. These pads also could be opened up and used in other parts of the body if someone else has a condition that warrants that. Why are the pads flexible, and are some of them more flexible than others? Well, they're all made of neoprene, so that's going to let you fold these like you see here along the width. And all the pads are going to come with those multiple Velcro straps, as you can see on the top of the foot and up around the calf and the shin, to attach these. So what happens in the unlikely event of a pad breaking? On the clinical line, there's a 2-year warranty. On the express line, there's a 1-year warranty. All you need to do, or all your patient needs to do, is simply fill out the repair form that's on the website and go ahead and mail it back in for us to take a look. We'll repair or replace it under warranty. If it's out of warranty, we'll quote a price for the repair, and that can be authorized before we do any work. So what's a key difference between HealthLight and other light therapy products? If I had to boil it down to one thing, I would talk about the duty cycle. Duty cycle is how often the lights are on compared to how often they're off when they pulse. So our duty cycle is 50%, which is much higher than many on the marketplace. That means, given the same amount of time as another product, we're going to get more energy into the body. More energy is going to result in more healing more quickly. So let's quickly summarize here. Why is HealthLight different? Better product design, more power. We've got the wavelengths, whether they're blue or red or infrared, that get nice penetration and treat different conditions and different needs that we want. We're going to increase that nitric oxide. We're going to stimulate that ATP production. The Velcro straps can let us put the pads on for optimal placement. And we understand there are better protocols, and that combining together some of those treatments like physical therapy or nutrition or laser or PMF, et cetera, into a treatment package is going to get the best result for your patients. It's going to get them to understand what you're trying to accomplish. You set those objective measures up front, and then you show them later how it's happened. And of course, we're going to address that pain, the lack of circulation, the muscle spasms, et cetera, along the way. And that's going to get you the result that you're seeking and have happy patients. And those happy patients are going to give you more referrals. More referrals is going to lead to a busier office, higher revenue, therefore higher profits for you. We're happy to answer questions that you have we haven't covered here. And the easiest way to do it is to write to me directly, rob@energiamedical.com. That's rob@energiamedical.com. You can always write to HealthLight as well. That email is marketing@healthlightllc.com. Marketing@healthlightllc.com. Really appreciate your time you spent with us today. We've got lots of materials we're happy to send with you. If you will like pricing, more product information, let us know. Again, at my email, rob@energiamedical.com or marketing@healthlightllc.com. Look forward to seeing you again on a future webinar. Thank you very much for your time today.
All right. Hey, everybody. Thanks, Rob. That was a fantastic webinar. And so now we are live with Rob Berman of HealthLight, and he is here to facilitate any of your questions. It looks like we already have a question that came in. I'll read it for you, Rob. Can the device be placed over bandages in the case of a wound, or does it need to be directly on the skin?
Good question. So I would expand it to not just bandages, but any kind of antibiotic or anything you have on there. We want to put it directly on that wound because anything in between will block some of the power. Now, that said, we don't want any cross-contamination. So the easiest way to do that is to actually wrap that wound in a little bit of plastic wrap, like a saran wrap or something like that, and put the pad directly on top of it.
Okay, very good. If anybody else, that was the only question we have sitting in the queue box right now. If anyone else has questions for Rob, take the time to type them into the Q&A. You can also type them into the chat. And then also, just as a quick reminder, if you want to use your voice to ask Rob a question, you can use the little raise hand icon and we will unmute you. But it looks like we do have another question that came in. How do you clean or disinfect the device? How long does the device last with standard use?
Okay, so two different questions. Let me take the second one first, which is how long does that pad last with standard use? So the clinical models come with a 2-year warranty. The at-home come with a 1-year. That's the warranty, but in practical terms, I talk to people all the time who've had a pad for 10 or more years. So they don't wear out. The LEDs are designed to go for thousands and thousands of hours. So as long as you're properly taking care of your pads, not slamming them into drawers, or doing crazy things like that, rolling over them with chairs, they should just keep on lasting and lasting and lasting. So the other question was, how do you keep them clean or how do you keep them sanitary, particularly in the kind of this COVID times? And the best way to do it in office is with some plastic bags. Companies like Uline sell all kinds of bags. I can direct you to the styles that work. There's some that are really nice that are just kind of long. You can put right over the foot, the leg, treat right on top. At home, patients, not so much of a risk, but even there, we do suggest that they put them in bags just to keep them clean and safe.
Okay, very good. Is that the same? That's the one we just answered, okay. All right, so just waiting for a couple more questions to come through.
And also, HealthLight is hosting office hours later today at 3 o'clock Eastern time. So if while you're going about your day, more questions occur to you, you can hop into their office hours where we'll just be hanging out live, answering your questions. So pop in and say hello and ask any questions that you might have at that time too. And also their booth has a ton of resources on it available for you. So be sure to navigate over to their booth page from our main exhibit hall. They've got their show special listed there. They've got resources and downloads. Their booth is interactive. And then head over to the swag bag page and make sure that you claim your swag from HealthLight. Oh, we've got one more question that popped up. Let's take a look. Is this good for arthritic pain?
Absolutely. So any kind of itis, which is going to be an inflammation, whether it's kind of the gouty arthritis, we've got, or just plain old RA, OA, yeah, it's going to work for all that. We're going to help with the pain relief. We're going to help with any inflammation there. Part of the thing is going to happen is we're going to increase the circulation. So we're going to get more of those good nutrients and oxygens in the areas and speed up the removal of the waste products.
Fantastic.
And Rob, I know that I've seen some chats come into your chat page with some questions about how can I see the device? How can I you know, test it out in my practice. So where are you located? What is your like sphere of influence where you can go and visit practices? And then if someone is outside of your area, how do they, you know, get more information and maybe hands-on?
So we sell nationwide, of course, and have done that for 15 years. I happen to live in Connecticut near the city of Hartford, but that makes no difference because we can reach out to anybody to do stuff. Most often, what we do is we have doctors will go ahead and will get one pad to try it out with the patients, try it out in the office, kind of a demo pad. And once they go there, they end up ordering them. And we offer volume discounts, things like buy 5, get 1, buy 10, get 2, those kinds of things, as well as packages with free pads. So it's really not a very big barrier to get patients interested in doing this. The other thing we also have are some really nice charts that show you how to sell packages for conditions, say like neuropathy, where you put this in with other modalities you might be doing, like we talked about in the video, whether it's nutrition or PMF or laser, whatever the case may be.
Okay, good. So another chat came through. I have a friend who's a dentist who treats TMJ. Any risk of herpetic exacerbation?
There's always a little bit of risk that pain could increase. You know, statistics show us that maybe 3% of the time you might get some increased pain. Usually it subsides within 24 to 48 hours. And then when you apply it again, it does generally work. The 64 pad, a real small one, is the best one for dental situations or dentist offices because the jaw itself isn't that big, although you could use like that 90 pad because it's nice and long and thin as well.
All right, good. So I'm going to give it another minute or two. If any other questions occur to you, just raise your hand using the raise hand feature, or you can type them into Q&A or chat and we will answer them. And just as a reminder, visit every exhibit booth, check in using the bingo button to register to win prizes. Everyone that is watching this webinar live is registered to win the HealthLight door prize, which I feel like it was a good one. I don't remember.
AirPods.
Oh, the Apple AirPods. Yes, yes, it is a good one. Okay, so everybody's registered to win that. You'll be notified probably next week to determine the winner. Give us some time to run some reports. And then we've got Dr. Chris Mielke's keynote coming up at 12 noon Eastern. So you don't want to miss that, how to increase capture revenue in your practice. And I've got one more question that came in. Did not hear the full lecture, but is this something that is used for back pain following MVA nerve pain in hip?
Absolutely. You can use the pads all over the body. The only places we suggest you don't do it, of course, would be the infrared over the eyes, over the thyroid, or over the pregnant belly. So yeah, we've got some nice big pads that could help with that. Sarah Ann, if you can capture that person's information, I can send them directly information for that. So one other thing I just want to suggest to everybody, going back to one of the questions, it said, well, how do I get patients interested? We've got posters for the office. We've got brochures. Just let us know. I'll send you off a nice little care box and you can put it up in the office to help gauge some patient interest as well.
Fantastic. And just a side note, with that question, they said that they didn't see the entire webinar. We are uploading these webinars after the fact. So we had one earlier this morning that is uploading now. As soon as we sign off, it will process, we'll upload it, download it, all the things that you have to do. And so give us a couple hours and this webinar will be on the site. So anywhere previously where you saw join the HealthLight webinar will be replaced with this video. So if you missed anything or if you want to share it with anyone, there's access to that.
Or if you just really want to see Sarah and Ann all the time over and over again, you can just watch all the webinars on demand.
Everyone would love to do that. All right.
Rob, thank you so much for your time and your expertise. We appreciate your support of the Expo and your involvement, and all the attendees. Thank you so much for spending your time here with us today. And make sure you join us for all the fun stuff we've got going later on today. So
we'll see you at noon for Dr. Mielke's keynote address.
Okay,
Thank you.
everybody.
Bye.
everybody.
Bye.